If you are new to using the VDP-PRO, many of the general instructions given here are the same in all areas of the spine. To effectively use the VDP-PRO for flexion distraction in the lumbar spine, use the gold instrument. It is important and helpful to start by creating some passive flexion in the spine. You can use an adjustable table to lift the pelvis, or use blocks or wedges placed under the pelvic bones on each side to raise the pelvis above the lumbar spine. It is important to have accurately located the level you'll be distracting and to place the tips of the VDP-PRO on the proper locations. For example, if you're going to use the VDP-PRO at L4, L5, place it vertically along the spine with 2 tips on L4 and 2 tips on L5. When you position the VDP-PRO, the legs need to be perpendicular to the spine. Take your time to locate the proper level and position the device carefully. You may want to do a little soft tissue pull stretch of their skin superior and inferiorly with your other hand before you position the VDP-PRO. This can really help you get deeper into the soft tissue. Essentially, the goal of the VDP-PRO is to distract or separate only the posterior aspects of the involved vertebra without moving its anterior parts towards one another too much. If your goal is to reduce a herniated disc, keep in mind that only a few millimeters of separation of the vertebra is necessary to create the desired centripetal or towards the midline effect within the nucleus pulposus. The centripetal force is what draws or pumps the herniated portion of the disc back into its normal anatomical position. Too much separation of the posterior aspects of the involved vertebra can cause the anterior portion of the adjacent vertebra to move towards one another, and this will negate the centripetal force within the disc. If the anterior portions of the vertebra move too much towards each other, a centrifugal force will be created, pushing the herniated or bulging portion of the disc further out past its normal anatomical boundary. A centripetal force moves towards the center of the nucleus pulposus. A centrifugal force moves outward, promoting the disc bulge. The flexion distraction created by the VDP-PRO will of course open up the facet joints and relieve this very common facet syndrome subluxation pattern and source of altered neurology and much pain and dysfunction. You can relieve it all with this one awesome strategy. The VDP-PRO allows enough separation of the legs to distract even the largest of patients. Keep in mind that you do not have to separate the legs to the maximum for most patients. Start with less distraction at first, especially with a known disc herniation, and evaluate your results. If the spinal condition is more degenerative in nature, and your goal is to simply make things better to release adhesions, stretch the myofascia, reduce the facet imbrications, restore their altered neurology, and decompress the disc to generally facilitate some mobility and hydration, then you can use a bit more distraction and provide a tremendous benefit. A few more tips for all areas of the spine. Being too far above or below the proper contact points can result in undesirable effects, especially when a herniated disc is involved. It is imperative to have proper placement of the VDP-PRO upon the spine to achieve the best results. Again, start at each level you are adjusting with a smaller amount of distraction and get a sense of the tissue resistance. And of course, you can ask the patient if there's an increase or decrease in their symptoms, especially when you perform the first distraction. Often I will simply ask, how good does that feel? If there's any response other than awesome or really good or just fine, I may reposition the tips the next time superior or inferiorly just a few millimeters, or adjust their position slightly, like maybe adding a little bit more flexion. Once you have a good feel for that first distraction, then you can squeeze a little harder and distract a bit more the next few times. Occasionally, some patients will mention that the distraction pulls on their skin of their neck or their back or their hairs on their back and is slightly uncomfortable. Most will just deal with it as they're enjoying the great results they're feeling from your work. I've had a couple of them shave before their next visit, but usually that's not necessary. As with all techniques, doctors, we understand this. It takes time and practice to confidently and effectively apply it. It won't be too long, however, before you see the results and begin to see referrals from patients that you've helped tremendously with the VDP-PRO like nothing else has. And you'll be pleased with its simplicity and its tremendous effectiveness. Serve well And you can visit our website at www.vdp-pro.com. Thank you.